My name is Eric Walzer. I'm the chairman of radiology at the University of Texas Medical Branch at Galveston, and I also participate in a lot of interventional procedures for patients with cancer. My primary focus is in the field of interventional MRI, although our practice does a lot of other types of tumor ablations using different forms of energy. Focused laser ablation is a new type of thermal therapy for cancers. It became apparent that this type of thermal energy was also very useful in the area of the prostate gland, where nerves and other structures are in critical locations around the areas where the cancer is. And using laser to destroy these tumors gives us that kind of scalpel-like precision you need in an area where these structures live. Also, when we do the ablation under MRI, we use a special sequence in the MRI that allows us to see the temperature and to see the kill of the tumor as it's actually occurring. Once we've determined that the tumor is contained within the prostate and it's relatively small and easy for us to see, we start with a probe that's positioned within the rectum and it's adjacent to the prostate. That probe is correlated with the MRI, sort of like a GPS system, and this allows us to aim directly at the tumor with a special cannula that's advanced into the prostate cancer itself. Once the fiber is within the prostate cancer, we advance the fiber into the right location. We turn it on at a very, very low level, and that just allows the MRI to tell us that the laser's in the correct area and it's heating the tumor just very slightly. And once it's in the right place, as determined by this special sequence, we turn the fiber really all the way up and start to kill tumor. And there's a color-coded sequence on the MR console that tells us what we're killing, and we make sure that the border of the cell death extends just beyond the tumor to make sure we get the whole tumor, but not so far as to damage any of the nerves or other structures. One of the great features of focal laser ablation for prostate cancer, besides the fact that it causes much fewer complications, in other words 1 or 2% risk of erectile dysfunction or urinary dysfunction, the other side effects of pain or days away from work, all those other types of things that go with surgery are really completely eliminated in FLA, which is an outpatient procedure and very easy on the patient and their family. I think that the interventional radiologist or urologist that works as a team on these types of patients, they're all going to be rewarded by the fact that they'll see these patients get minimally invasive treatment, go home the same day, get back to work within 2 or 3 days, and have this low or intermediate risk prostate cancer treated effectively over many years.